So let's talk real quick about health of moms and babies and how seafood works with that. March of Dimes, you may know of that organization, ranks the United States a D plus in preterm births. So preterm birth is birth before 37 weeks, and early preterm birth is before 34 weeks. We get a D plus in the US. Here's the punchline of what I'm about to explain. Omega-3 fatty acids, if eaten by the mother, can reduce preterm birth before 37 weeks. That's the definition for preterm birth, by 11%. And for early preterm birth, before 34 weeks, which is where a lot of dangerous things can happen, by 42%. So eating omega-3s as a pregnant woman can reduce by 11% for before 37 weeks and by 42% for before 34 weeks. That's the whole punchline. Just to show you how bad it is, there's an NHANES study of pregnant women. And in this portion of the study, 0% of the pregnant women in this study ate at least 8 ounces of seafood a week. 0%. You know, the recommendations are 8 to 12 ounces of seafood per week for pregnant women. So 0% in this study were meeting that guideline. So there are a few significant kind of guidelines that just came out in February of 2024. 24 scientists, OBGYNs from a lot of different countries, on all continents, came together and created kind of these 10 main guidelines for women of childbearing age and currently pregnant women. If you want a healthy baby, this is what you do for DHA and EPA, which is omega-3 fatty acids and seafood. This is how you do it, and this is why it's important. So I want to walk you through those. First one is safety. Up to 1,000 milligrams of EPA DHA per day is absolutely safe. So in the US, and as a woman who has had multiple pregnancies and who has 2 beautiful children and have been through this, it is scary to eat seafood. In the US, we just have this crazy fear of mercury toxicity. And so a lot of women will actually avoid seafood when they're pregnant. And I actually traveled to Japan while I was very, very pregnant. And they were so confused as to why I wasn't eating the sushi. And we had this amazing dialogue back and forth of the OBs in Japan are encouraging intake of seafood and sushi and all these things, whereas the American OBs that I had been, seeing and reading and all these things were saying to decrease. So there is a big discrepancy. The first big point they wanted to make, all these scientists that published this in February of 2024 said up to 1,000 milligrams of EPA and DHA per day is completely and totally safe. Second was a consensus statement. All of these people said low intakes of DHA and EPA lead to a significant increase in preterm births. Period. End of story. Alongside that, they just basically wanted to write in a statement saying that intakes of EPA and DHA from seafood should be a regular part of a pregnant woman or a woman of childbearing age's diet. To get into the nitty-gritty, based on all these studies and this consensus statement, for the general population, which includes women, a regular intake of at least 250 milligrams of EPA and DHA is desirable. And then for pregnant women, and on top of that, an additional intake of at least 100 to 200 milligrams per day is recommended. So we're talking about 250, and then we're adding 100 to 200 on top of that for pregnant women. Then there's this high risk population. So the pregnant women with low DHA intake, so when they're talking to their doctors, they have low DHA intake, or they've actually done a blood test and you can see in the blood their DHA levels are low. They are at a very high risk of preterm and early preterm birth, and they need 600 to 1,000 milligrams a day of DHA and EPA, which they already established in that first guideline. Up to 1,000 is completely and totally safe. High dose supplementation should continue through at least 37 weeks and beyond. And the last few statements are just saying that identifying high-risk women is possible using a questionnaire, a set of questions that OBs can use in practice. And then it can also be done using blood measurements of DHA. And that it's important to verbally and orally, for doctors and scientists and, dietitians, people like me, to tell pregnant women of childbearing age, and their partners all this information and how they can get this from seafood. So these guidelines were published in February 2024 in the Journal of Obstetrics and Gynecology. And then after this presentation happened, another scientist in the room raised his hand and said that in his research, talking about the health of the mother, said that 1,000 milligrams a day of the omega-3s, EPA and DHA, actually prevent and treat perinatal depression. So if the supplementation and the eating of the seafood continues beyond 37 weeks, he's saying it's so important to keep that up because there's tons of research, even in his field, that don't have anything to do with the preterm birth, but it has more to do with the depression, the perinatal and postnatal depression that can happen. So all this is to say, there is so much good research and now starting consensus statements among scientists and OBs around the world of how safe and how necessary intake of seafood is for women of childbearing age and pregnant women.